Now we're going to do three-step equation. You'll see. The nurse is caring for a patient with a prescription for medication 125 microgram. This is what we order. The amount that it supplies is 0.5 milligram tablet. This is what you have on hand. How many tablets will the nurse give? The next question is, do you need any equivalent? Do you need to convert units to unit? Well, yes, we need equivalent. The order is in microgram, but what you have available is milligram. So at this point, we need to convert milligram to microgram, right? We're looking for tablet. Tablet, this is where we're going. If tablet is where we're going, tablet will be in the numerator. Where do I find that information? It's right here. For every one tablet, you have 0.5 milligram. What do we do next? We do the conversion, right? How do we convert? For every 1 milligram, remember, we have how much microgram? 1000 microgram. What do we have in the problem? What is the order? 25 microgram, 1. There's nothing else. Now, milligram, cancel out milligram, microgram, cancel out microgram, till you have left with what? Tablet. If you times everything on the top, everything on the bottom, you divide each other. What do you have? Half a tablet. Your patient is prescribed medication B, 2 gram PO. The amount supplied of medication B is 250 milligram capsules. How many capsules would the nurse give? What's the order? 2 gram is the order. What do you have on hand? 250 milligram capsule. Do you need any equivalent? Do you need to convert from unit to unit? Yes. Why? We give in 2 grams, but what we have available is milligram. So we need to convert milligram to gram. If capsule is where I'm going, cap would be in the numerator. Where do I find that information? It's right here. Per every capsule, it has 250 milligram. Next, let's convert gram to milligram or milligram to gram. 1 gram, it's equivalent to 1000 milligram. You guys remember, it's in the metric table. The order, 2 gram times 1. Gram, cancel out gram. Milligram, cancel out milligram. Till we have left with capsule. You multiply everything and then you divide it up. You should get 8 capsules per day. How many tablets will the nurse give? Anybody can solve that problem? Take your time and tell me what it is. What's the order? 0.5 milligram. That's the order. And what we have on hand, it's 80 microgram tablet, right? This is what we have on hand. Where will you go? We're going for tablet. Do you need any equivalent? Do you need to convert anything? Yes, because order is in milligram and you have available microgram, all right? If tablet is where you're going, tablet will be in the numerator. Where do we find that information? It's right here. You have 80 microgram tablet. Every one tablet has 88 microgram. Now, if you remember the metric table, it tells you at this point, per 1000 microgram, you get 1 milligram. What is your order? 0.175 milligram. And then 1 milligram cancel out milligram. Microgram cancel out microgram until you have left with tablet, and this is exactly what you're looking for. If you times everything on the top, multiply everything at the bottom, it will give you 2 tablets. You always have to double check. If it tells you have to give the patient 20 tablets, it's not a reasonable number. You have to double check. If you have your colleague, talk to your colleague and do the calculation with them.